with one of our new patient consults, and we just thought we'd make a nice little video just detailing her experience in exploring and trying to get good information about stem cells and orthobiologics for orthopedics. Tell us first, what joints were you investigating getting treated?
Both knees.
Both knees. And you went to, I think it was 2 separate seminars?
Yes, 2 separate seminars.
And were they run by chiropractors, or do you remember?
They were both chiropractors.
Okay. And tell me about what they told you the source of stem cells was going to be at those facilities.
One of them said it would be placental.
Mm-hmm.
The other one said it would be 100% umbilical cord, which they said was safer than the placental.
Did either of them mention any potential problems with those allograft products?
No, in fact, they both said that they were the safest things to use and that there had been 0 issues or complaints. There had been a 100% success rate.
And they mentioned 100% success rate?
Yes.
And both of these clinics are in Dallas, Texas, I should say. I know the names. I won't say them on this video, but if you want to know, let me know. So tell me, what was their plan? Besides injecting the knees, you said something else that was concerning.
Yes, the one that I actually did the follow-up visit with after the seminar said that they would recommend giving me 2 units. They said that the first unit would be divided with injections into my knees, a half unit each, and they said the other 1 unit would be just injected into me so it could go anywhere in the body that it was needed to be used.
And so they were talking about an IV injection. Now, the one clinic where you saw them, did they do x-rays or physical exam? What did they tell you?
No, they didn't do any x-ray or physical exam. And in fact, I asked specifically because that made me uncomfortable. When I did they said on the x-ray that if I paid and come in to do it, they would do the x-ray at that time and then re-x-ray it after 6 weeks.
And you actually had enough knowledge to ask about bone marrow. What did they say about bone marrow stem cells and that source?
Yeah, they and I don't remember the exact numbers, but it's like, for example, when you're first born, you've got millions and millions of these usable stem cells, and as you get older, there are fewer. In fact, I do remember when they said that you were 80 years old, there's only like 200,000. They did say that if you're over 29 or 30, that they would never recommend using bone marrow because you just don't have enough good stem cells.
And what did they say about how the process was to get the stem cells from bone marrow?
They said it was a surgical procedure done in the hospital.
So they told you you'd have to go to the hospital. So they really tried to scare you away from that, it sounds like.
Yes.
Now, the one doctor you did see, he was a chiropractor. How long had he been doing this? You had the foresight to ask him that question as well. What did he tell you?
He'd been doing it for 3 months.
3 months. And so your spidey sense was activated, and obviously you didn't have the procedure there, and you came to see us to get an honest opinion, and we appreciate that. And I really appreciate you sharing your story. One last question. Did they mention a price? Did you ever get to that point?
For the 2 units, the price was $6,500. That did not include weekly massages that they wanted you to have after that for another 6 to 12 weeks, and then some type of supplements that they said were about $70 a month.
Okay, well, thank you very much for sharing.
You're welcome.